So I was asked to come to talk a little bit about the value or the importance of doing a needs assessment and working together in a integrated systems way to identify shared goals and principles that you would want to work towards. Um, so I was thinking about this and trying to figure out, okay, how could I talk to somebody? How could I create an analogy that where they would really understand this? And I think for those of you who were here yesterday, a little bit of this will be some repetition. You'll kind of sense a theme here. Um, but the best way that I can think about this is to of the analogy of are you when you're a doctor, let's all be armchair doctors together actually today. Lots of people are armchair lawyers. Let's be armchair doctors together. So when you're thinking about when someone comes in and they have a bunch of symptoms, you could be a doctor who just treats the symptoms, right? You could treat the symptom of a headache or the symptom of a temperature. Or do you want to try to identify and treat the cause, right? And so any good doctor would tell you the symptoms are usually indicative of something else going on, right? It's you don't want to treat the symptom, you want to treat the cause. So I thought about this and I said to myself, okay, well let's think through some examples here, right? So a good example perhaps, let's again all be armchair doctors together. Let's say you have someone who is presenting. Everyone in my family are doctors, so this is how they talk. Someone presents with something with symptoms of blurred vision, heart rate, and fainting. What do you think they have? What's wrong with them? Any idea? Iron deficiency. That's a great one. Yeah. Anemia. What else? Could be a heart attack. I mean, that could be indicative of a heart attack. That's really serious. Could be anxiety. Absolutely. Who knows? So if we don't conduct a needs assessment on this individual that you're looking at who has those particular symptoms, you're going to have a lot of wild ideas about what might be causing those particular symptoms. But by running some general tests and learning more about the patient characteristics, i.e. doing a needs assessment, let's just say in this particular scenario, we learned that the person is actually otherwise healthy and young, with a BMI, which is a body mass index in the normal range. We also learned that the patient is struggling with hypoglycemia. And after some additional follow-up questions, we learned that they're struggling with a disordered eating. And then through that needs assessment, you identify that likely there's probably some sort of something related to hypoglycemia or some sort of eating disorder issue. And so how you would address that, right, would be through perhaps conversations with the patient about the risk of diabetes if they continue on this path, or the need to work with a nutritionist or perhaps a therapist who's going to help that person work forward. However, if you did a needs assessment and found that the patient was actually 70 and had a previous heart attack and maybe had a history of smoking, the cause would have been more likely to be tachycardia or sick sinus syndrome or something more serious that would have required medication to treat. Or if the patient had had a high BMI and hypo or hyperglycemia, the cause might have been diabetes, which would have required insulin injections. But again, think about those three different scenarios, right? So if you had the scenario that I'm presenting to you now, the person is otherwise healthy, they're young, there's only a couple things after you run all these tests, in other words, do a needs assessment, that would tell you that this is probably something to do with hypoglycemia and perhaps an eating disorder. But this is just kind of an analogy or an example to demonstrate to you that if you don't do a needs assessment, you're not going to know the other characteristics that are really critical to helping you determine what is really at the root of these symptoms, or what is the root cause. And in education, we're really familiar with that term, right? Root cause analysis. So let's think about this in another example, and not a health example, but in a broader interconnected systems or integrated systems example. Let's think about the three symptoms of homelessness, demand for services, and foster youth. So in this example, if those three symptoms are presenting themselves in a community, what might that be indicative of? So with homelessness, it could be a symptom of a poor economy or a lack of affordable housing or increased drug or alcohol abuse. Could be any of those things. Could be a million other things, to be honest. If demand for services are increasing, it could be, again, a symptom of a poor economy or effective advertising. Maybe people are just showing up more because you've got the word out into the community and they're realizing that there's all these services out there and they're just not taking advantage of them. Or maybe it's a closure of some other supportive services that, recently they ran out of money, they were grant funded, and now everyone is flooding to your doors because they were getting services somewhere else. With foster youth, if you're seeing a huge increase there, it might be symptom of increased drug use, or could again be a poor economy. It could be lack of birth control access, or maybe lack of sex education, right? These are all things that could cause those increased numbers. Now, by conducting a needs assessment, let's say you find out some additional factors or some additional information. You find out that there is a mild economic decline, but it's not major. It's only been a slight dip. And you find out that the age of homelessness has significantly decreased. So the average age used to be about 60. So that's relatively common in a community. For folks who are retiring or folks who are veterans, it's relatively common to see a pretty high average age for homelessness. And in fact, in this community, it's dropped from 60 to 35 really quickly. That should tell you something. If you also have, as part of, let's say, like a data dashboard, like we talked about yesterday, you're also collecting information about opioid deaths, and you see that those have tripled in the last 5 years, that drug arrests, there's twice as many of them. And then reports of neglect have increased when school staff are some of the greatest reporters of abuse and neglect of children. And let's say that has increased by 35%. And you see that migration out of county is actually relatively high. And so therefore, that's freeing up housing. So what do we think the issue is? Anyone? All right, well, this is actually based on a relatively real world example. So believe it or not, one of the first signs of the opioid epidemic on the East Coast was actually a massive increase in foster youth. Isn't that fascinating? That was when people were really starting to, it was people in the system working for the county, it was social services who first were kind of like, something is not right here. We're removing more kids from homes. We're seeing more instability. We're seeing more transition. We're seeing more and more kids without parents in the household, living with relatives or living with grandparents. The first real indication sign that there was an opioid epidemic was foster youth increase. Fascinating, right? I thought that was really fascinating. So this is just kind of a great example of why doing a needs assessment is so critical, because otherwise you're essentially shooting in the dark. You don't know if your patient is 70 or 15. You don't know if your patient has a history of heart attacks or has no history of heart attacks. You don't know anything about essentially you don't have critical information to make decisions that are going to inform whether or not the interventions you implement are effective. So really briefly, let's just go over some of the common critical elements of a needs assessment. The first, of course, is multi-sector data, right? If you have a needs assessment like we talked about yesterday with the data dashboard that is just education, that isn't going to tell you a lot. It's not going to tell you much. It's going to tell you about some outcomes. It's not going to tell you about a lot of inputs. So looking at across all the sectors, like we talked about yesterday with the data dashboard, is going to give you far more detailed information. And it's really critical to kind of think about, again, as I mentioned yesterday, a lot of the outputs from education are impacted by inputs that education has nothing to do with, like parent graduation rate, whether or not parents graduated from high school, whether or not they graduated from college, what their income level is, and all kinds of various other factors that education can't really impact, but a community as a whole, an integrated system, can. Existing investments are also something you should look at, and whether or not they're working. Demand and referrals is definitely something that you should be looking at. So that was that last dashboard that I showed you yesterday. Is the demand increasing? Is it not increasing? And this is a really critical thing to look at too, because when we don't actually look at demand and referrals, we sometimes can we come up with wrong answers. Essentially, if we do such a great job of letting the world know that services are out there and we do a great job of meeting need, we can actually misidentify what's really going on. You might think that there's actually a crisis happening, but the reality is you're running a great education campaign, and so more people are coming to your door. So it's really critical when you're thinking about a needs assessment to think about, is it actually that there is more need, or is it just that we're doing a better job of identifying and meeting that need? System responsiveness and churn is also something I talked about a little bit yesterday, because that's a really good indication of, are the agencies working well together? Are we meeting the needs of the whole child and the whole family? Community characteristics, I think everyone acknowledges that that's a really critical component of a needs assessment. And then finally, changes over time. So here's something that kind of irks me, has always really irked me a little bit when I look at various different data dashboards. Almost all of them are these macro measures that are really, really hard to change, if not nearly impossible to change. So a needs assessment really needs to look at what are changeable measures in relatively short periods of time. The reason I say that, the reason I tell you that is, as we've kind of, everyone is, well, not everyone maybe, but a lot of people have alluded to that there is a political element in all of this, right? That we are motivated, and the people that we work for are motivated by a political element in all of this, to work together, to share resources, to collaborate. And at the end of the day, politicians are elected for a certain period of time. So you need to look at changeable characteristics as part of your needs assessment and as part of your data analysis. Because if you're not looking at characteristics that can be changed within a relatively short amount of time, and when I say that, I mean 2 years, maybe 3 years. If you're looking simply at macro measures like poverty rate or unemployment rate or academic performance, those are things that take a very long time to change. And it will disincentivize people from engaging in a needs assessment conversation or a data dashboard conversation, because the change is not going to come after 2 years or 3 years. It might come after 10 if you stick with it, right? So you have to have elements as well that can kind of encourage the politicians who are investing their time and energy and resources into this to demonstrate to them that your efforts are creating success along the way. So that's it. There you go. I think a needs assessment is important. I think a lot of people kind of recognize that. And hopefully, as you're thinking about needs assessments, there's lots out there. Hopefully you'll be thinking about these kind of critical elements and what you need to do to really incentivize folks who are making decisions to continue staying on this path and to continue blending resources, braiding funding, and collaborating together.